Hi, I'm Chris, and today I'll be doing an internal feeding. First thing I'm going to do is I'm going to confirm the identity of my patient using two forms of identification. So state your full name and date of birth. He does, and then I double check that with a second form of identification, which is the wristband. And it matches what he said, so that's two forms of identification. Today, I'm going to be performing internal feeding. Have you had any nausea, vomiting, diarrhea? No, he hasn't. So first thing I'm going to do is wash my hands. Okay, and I've gathered all the supplies I need for the whole procedure. I'm gonna raise the bed to the height that's comfortable for me, and then the patient is lying supine right now, so I can perform an abdominal assessment. So first, I'm gonna expose the abdomen. I'm just gonna inspect the abdomen for shape and all that, so it looks flat. It doesn't look appear to be distended or anything like that. Second thing I'm gonna do is auscultate. And I've already asked the patient if he has nausea, vomiting, diarrhea, or constipation, to which he said no. So now I'm auscultating for vowel sounds, listening for gurgles, cracks, active vowel sounds, active vowel sounds, active vowel sounds, and active vowel sounds. Now that I've auscultated and inspected, I'm going to percuss. Good. And now I'm going to lightly palpate. Do you feel any pain? Or any discomfort? No? Alright, now I'm going to palpate deeper. Now I'm pulling away quickly, checking for rebound tenderness. Nothing. 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 Okay. So that concludes the abdominal assessment. I'm going to raise the head of the bed to 30 to 45 degrees. And I'm going to place a waterproof pad on the patient's chest and apply gloves. Alright, so first thing I'm going to do is I'm going to check to see if the patient has an x-ray of the tube being placed, so I can confirm that it was placed in the stomach. Next, I'm going to measure the length of the tube from the nose to the end of the port there. So the tube is 25 inches long, so then I would take that number and I would check it or cross-reference it against how long that tube was when they first placed it to ensure that the tube hasn't come out a couple of inches or gone in a couple of inches, so that it's in the proper place for the feeding. Okay. Next, I'm going to remove residual from the stomach, and I'm going to test the pH. When I remove the residual, I'm going to note the color and the consistency, which should be a green, tan, or a light yellow color that is cloudy, or an off-white color that is cloudy. I'm going to pull back 50 milliliters at a time. That way I can keep track of how much I'm removing. So I've removed 50 milliliters and I've plugged it. Now I'm going to put a small amount onto the strip, the pH strip, and I'm going to note if it changes color, and what we want is we want that pH to be 5.0 or less. And then the rest of the contents of the stomach will go into the graduated cylinder here. And then one more time, I'm going to remove another 50. And recap it. And then emptying out the residuals back into the graduated cylinder. Once again, I'm noting the color and consistency. And then I also want to note if 250 milliliters or more came out, because if more than 250 milliliters came out, then I cannot continue the internal feeding. So for this sake, we'll say that 80 milliliters came out, so we're good to continue, and we'll say that the pH says that it was at 5, which is what we want, so we're good to continue with the internal feeding. Next, I'm going to get a new syringe. And I'm going to empty the contents of the graduated cylinder, the residual, back into the syringe slowly. So we're emptying it back in, and then we're keeping it, now we're unkinking it, and we're keeping it low so it enters slowly. And then while we're doing this, I'm asking the patient if they feel any discomfort, nausea, anything like that, headache. So we'll say that the contents are about at the 3/4 mark, let's say 20 cc's. So now I'm going to start to flush. So I'm going to confirm that this is sterile water and that there's that it doesn't fall past the expiration date. I'm going to flush it with 30 cc's. So I add 30 cc's, it starts to flush. I'm going to kink it now. And getting a new syringe. Getting a new syringe. Now I'm going to confirm the product that we're supposed to be using, which is Jevity, the amount, and the expiration date. And then I would pre-clean the tip of the bottle before using it. I would shake it well. Now emptying it in, I'm going to empty it in 50 cc's at a time to keep track. So we'll say 50 cc's and then unkink it. And once again, I'm keeping it relatively low so that it doesn't drain too quickly. And I'm still asking the patient, do you feel any nausea, vomiting? Do you feel do you have a headache? Anything like that. So once it gets down to the 3/4 mark, around 20 cc's, we'll add another 50. Letting it drain slowly. And we'll say it's once again about the 3/4 mark, and we're going to flush it one more time with 30 cc's. And let that drain slowly. And then once it's completely drained, remove the syringe and recap. And I would leave the patient with their head of the bed at 30 to 45 degrees for 1 hour and constantly check up on them. Please start recording.